25 practice CNA exam questions with answers. Question number 1. The nurse's son called and asked her to bring home a package of bandages, so the nurse grabbed a package from the facility's stockroom to take home. Which of the following options best identifies this action? A. Negligence. B. False imprisonment. C. Theft. D. Aiding and abetting. Correct answer is C. Theft is a legal and ethical issue that involves taking an item that belongs to someone else. In this question, the nurse aide took a package of bandages that belonged to the facility. Therefore, she was taking something that did not belong to her. Negligence is an act that results in patient harm due to the nurse aide omitting care to the patient or incorrectly providing care to the patient. False imprisonment is when a patient is restrained from moving freely about against his or her wishes. Aiding and abetting is when a nurse aide sees an unlawful act and does nothing about it. Question number 2. What should a nursing assistant do when he or she notices warning signs that indicate the patient may be developing a bedsore? A. Immediately report the warning signs to the patient's assigned nurse. B. Administer the medication that is used for healing bedsores. C. Monitor the warning signs to see if they get worse. D. Ignore the warning signs until a bedsore actually develops. The correct answer is A. The nursing assistant should immediately report the signs to the nurse. Warning signs of a pressure sore include redness or skin discoloration, site tenderness, a dark scab, or an area of skin that feels cooler or warmer than other areas. Question number 3. A patient chokes while eating. The first thing the nursing assistant should do is A. Ask the patient if she is choking. If so, perform the Heimlich maneuver. B. Call for a licensed person. C. Slap the patient between the shoulder blades. D. Tilt the victim's head back and give 2 quick breaths. The correct answer is A. The Heimlich maneuver, also referred to as abdominal thrusts, is an emergency response technique that can save a life in seconds. It is a simple action that will often dislodge food. Question number 4. Which of the following options is not considered effective verbal communication? A. Speaking clearly. B. Asking open-ended questions. C. Avoiding eye contact. D. Clarifying what you heard. The correct answer is C. Verbal communication is communication that requires you to speak. Speaking clearly, asking open-end questions, and clarifying what you heard are all types of communication that require you to speak. Avoiding eye contact is a form of communication. However, it is a form of nonverbal communication. Nonverbal communication is communication that is performed through one's body language, such as crossing your arms, rolling your eyes, or smiling. Question number 5. An elderly patient who has been diagnosed with Parkinson's disease may be affected by all of the following except A. The ability to stand. B. The ability to stoop. C. The ability to walk. D. The ability to learn new skills. Correct answer is D. Parkinson's disease may cause patients to have chronic conditions, which include muscle tremors or arthritis that may affect their ability to walk, stand, or stoop. Patients who have difficulty walking or standing are more apt to fall, which could lead to injuries that will require hospitalization. However, Parkinson's disease will not affect an elderly patient's ability to learn, nor does the aging process. Question number 6. It is important that dressings remain A. Tight to keep out bacteria. B. Loose to admit air. C. Clean and dry. D. Untouched until ordered removed. The correct answer is C. Keep dressings clean and dry. If the dressing becomes soiled or saturated, notify the nurse. Question number 7. Which of the following options best describes methicillin-resistant Staphylococcus aureus? A. A viral skin condition that infects the patient's nerve path. B. A skin rash caused by an infestation of tiny mites. C. A staph infection that is resistant to antibiotics. D. A life-threatening skin disease that spreads through the air. The correct answer is C. MRSA is best described as a staph infection that is resistant to antibiotics. MRSA is a communicable disease that if left untreated it could affect the nursing facility's entire population. Scabies is a skin rash that is caused by an infestation of tiny mites. Shingles is a viral skin condition that infects the patient's nerve path. Question number 8. Which of the following options identify the two general goals of skincare when bathing a patient? A. Maintain appearance and promote sleep. B. Remove body sweat and reduce oiliness. C. Promote comfort and remove pathogens. D. Improve circulation and inspect skin. Correct answer is C. The two general goals of skincare when bathing a patient are to promote comfort and remove pathogens. Bathing a resident also gives the nursing assistant an opportunity to inspect the patient's skin. Question number 9. A nurse's aide notices blood in a patient's IV tubing. The aide should A. Notify the nurse. B. Do nothing. That's normal. C. Try to flush the tubing. D. Stop the IV. The correct answer is A. Notify the nurse. Most nurse aides are not legally allowed to prepare or give IV injections, or stop IV infusions. Question number 10. You are assigned a comatose resident that is in need of oral care every 4 hours. Which of the following options identifies how you should provide this patient with oral care? A. Assist the patient by cleaning his or her dentures and swabbing the patient's mouth and mucous membranes. B. Be sure the patient's head is turned to its side and use the proper equipment to swab the patient's mouth and mucous membranes. C. Gently open the patient's mouth and brush his or her teeth. D. Ask the patient's permission prior to providing oral care with approved equipment. Correct answer is B. Ensure the patient's head is turned to its side to allow the secretions to drain from the mouth. A comatose resident is one who is unconscious. Therefore, he or she cannot assist with their own oral care. You should always be sure that the patient's head is turned to its side, to prevent the patient from aspirating, and that you use the proper equipment to swab the patient's mouth and mucous membranes. Question number 11. All of the following are physical signs that a resident is in pain except A. Tachycardia. B. Hypotension. C. Tachypnea. D. Dyspnea. Correct answer is B. Hypotension, or low blood pressure, is not a physical sign that a resident is in pain. Hypertension, or high blood pressure, is a physical sign of pain. Tachycardia, increased pulse, tachypnea, increased respirations, and dyspnea, difficulty breathing, are all physical signs of pain. Other indicators of pain can include sweating, grunting, crying, or moaning. Question number 12. You are asked to take the patient's radial pulse. Where on the patient's body would you perform this task? A. Neck. B. Behind the ear. C. Apex. D. Wrist. Correct answer is D. The radial pulse is felt on an individual's wrist. If a patient has a heart disease, you should measure his or her radial pulse for a minimum of 1 minute. Question number 13. When you are recording your observations of a resident, it is important that you do not A. Sign your name. B. Use blue or black ink. C. Make corrections. D. Use red ink. The answer is D. You should not use red ink when you are recording your observation of a resident. You are only permitted to use blue or black ink when recording patient information. It is mandatory that you sign your name and title to all entries that you make. It is okay to make mistakes when documenting. However, you should not scratch out the mistakes, nor should you erase them or use a liquid eraser. Question number 14. The tympanic membrane temperature is one in which you A. Take the patient's temperature using his or her ear. B. Take the patient's temperature using his or her axilla. C. Take the patient's temperature using his or her anus. D. Take the patient's temperature using his or her mouth. Correct answer is A. You take a patient's tympanic membrane temperature using the patient's ear. The axilla is used to take the patient's axillary temperature. A rectal temperature measurement is measured through the patient's anus. The oral temperature measurement is measured through the patient's mouth. Question number 15. A patient has a diagnosis of psoriasis. Her nurse's aide should A. Avoid contact with the highly contagious lesions. B. Wear gloves for patient care. C. Treat her the same as any other patient with a non-infectious disease. D. Wear a mask when entering the room. The correct answer is C. Treat her the same as any other patient with a non-infectious disease. Psoriasis is not contagious. The skin condition cannot be passed from one person to another. Question number 16. When taking the patient's radial pulse the first time, you find that his pulse rate is 45 beats per minute. Which of the following actions should you take next? A. You should recount the patient's pulse for 60 seconds. B. You should immediately notify the patient's nurse. C. You should record his pulse rate on his chart. D. You should take the patient's blood pressure. The correct answer is A. If a patient has an irregular pulse rate of 50 beats per minute or less, you should recount the patient's pulse for 60 seconds. If the patient's pulse rate is still under 50 beats per minute after counting it the second time, you should notify his or her nurse immediately, as it could indicate a serious condition. Question number 17. When applying a condom catheter, what do you need to do? A. Leave as little of a space as possible between the catheter and the penis. B. Leave a 1-inch space between the catheter and the penis. C. Encircle the penis with tape to secure the catheter. D. Tape the catheter to the resident's lower abdomen. The correct answer is B. When applying a condom catheter, you need to leave a 1-inch space between the catheter and the penis. You would never want to encircle the penis with tape, as it may cause a tourniquet effect. Question number 18. Which of the following is not true of dementia? A. People with dementia act incooperative to be spiteful. B. They can have hallucinations. C. People with dementia are often frightened and anxious. D. Grooming is difficult for patients with dementia. The correct answer is A. People with dementia act incooperative to be spiteful, is not true. Dementia patients who are mean and aggressive are most likely feeling fear, anger and embarrassment because they have been asked to use skills that they no longer have. Even extreme dementia behavior, such as pacing, rummaging, and wandering, should be addressed calmly and compassionately. Question number 19. One of your patients is blind and it is your responsibility to assist with feeding her lunch. While feeding the patient, you should do all of the following except A. Inform the patient what she will be eating. B. Conserve energy by pacing the patient's bites. C. Provide liquids for the patient to sip. D. Keep silent so the patient can enjoy her meal. Correct answer is D. When you are feeding a patient who is blind, you should not keep silent. You should socially interact with the patient during mealtime to increase patient satisfaction. You should also be sure to inform the patient as to what she will be eating and provide the patient with liquids to sip. Question number 20. When it comes to communicating with patients who are hearing impaired, which of the following statements is true? A. You should place yourself to the patient's side. B. You should speak slowly, in a high tone. C. You should speak short, clear statements. D. You should increase the background noise. Correct answer is C. When communicating with a hearing-impaired patient, you should speak short, clear statements. You should also place yourself directly in front of the patient, slowly speak in a low tone, and decrease the background noise. When working with hearing-impaired patients, it is also important to remember that you need to slow your speech. Question number 21. A patient who is dysphasic is one who has trouble A. Breathing. B. Thinking. C. Walking. D. Speaking. Correct answer is D. A patient who is dysphasic is one who has trouble speaking. A patient can become dysphasic due to several reasons, including stroke, Parkinson's disease, Alzheimer's disease, and cancer. Remember, it is important that although the patient may be hard to understand, he or she can understand you, as their condition does not affect their intelligence. Therefore, it is important to always be respectful, compassionate, and patient. Question number 22. In order for a nursing assistant to be considered a team player, what must they be willing to accept? A. Harassment. B. Hazardous duties. C. Constructive criticism. D. Verbal abuse. Correct answer is C. To be a team player, a nursing assistant must be willing to accept constructive criticism. It is vital that a nursing assistant listens to their supervisor's feedback in a non-defensive manner, as constructive criticism is given in order to improve the nursing assistant's performance and his or her job satisfaction. Question number 23. Which of the following actions do not decrease with age? A. Need to sleep. B. Need to void. C. Need to eat. D. Need to defecate. Correct answer is A. An elderly patient needs just as much sleep as any other adult. Therefore, their need to sleep does not decrease with age. It is essential that an elderly patient has time to rest and to take naps, as it is essential for the patient's health. An elderly patient's appetite does decrease with age, along with their need to urinate or pass feces from their body. Question number 24. When providing oral care to a resident, how should you position the patient? A. In the supine position. B. In the Sims position. C. In the orthopneic position. D. In the Fowler's position. Correct answer is D. When providing oral care to a resident, you should position the resident in the Fowler's position, which you would do by raising the head of the bed. By raising the head of the patient's bed, you are positioning them in an upright position, which will help prevent them from choking during the oral care. Question number 25. When providing denture care for your patients, you should do all of the following except A. Use cool or tepid water to clean and rinse the dentures. B. Carry the patient's dentures in your gloved hand to the sink for cleaning. C. Line the sink with a paper towel to reduce the risk of breaking the dentures. D. Store the dentures in a denture cup filled with clean water. Correct answer is B. You should not carry the patient's dentures in your gloved hand to the sink for cleaning. In order to transport the patient's dentures to the sink, you should place them in a denture cup before transporting them. You should always use cool or tepid water for cleaning, rinsing, and storing dentures. You should also line the sink with paper towels in order to reduce the risk of breaking the patient's dentures if you should drop them. For more CNA exam practice questions, visit Florida Training Academy's YouTube channel. Thank you for watching.